and the left atrium is the midline cardiac chamber. Then here, this is the left atrium, and this is the right atrium. And this is the right ventricle, and this is the left ventricle, and this is the aortic root. Then going down, you see the left atrium, right ventricle, left ventricle, lower down, and this is the left ventricle, right atrium, left atrium. And lower down, this is the left ventricle, right atrium, left atrium. And this is the entrance of the inferior vena cava into the right atrium, and this is the dome of the liver. Then you have reached the lower part of the chest. Then the CT scan of the chest should not be ended until you reach the level of the suprarenal gland. And this is the level of the left suprarenal gland and the right suprarenal gland, which appear like an inverted Y. And then whenever the suprarenal glands are involved by masses, you can see a mass in the above and anterior to the kidney, and another mass above and anterior to the kidney. This is bilateral suprarenal metastasis from bronchogenic carcinoma, and this is the normal appearance of the suprarenal gland. We would like the operator to reach the level of the suprarenal gland, because you know that bronchogenic carcinomas have a high incidence of metastasis to the suprarenal gland. Then we came to the normal anatomy of the mediastinal lymph nodes. And you should know that the normal lymph nodes are not really seen in the scan. The nodes are only seen whenever they are enlarged. Then there are 9 locations of lymph nodes in the mediastinum. The first one is the retrosternal, behind the sternum. They are also known as internal mammary lymph nodes. And this is the sternum, and these are the lymph nodes, which are the retrosternal group. The second group is posterior to the superior vena cava, and this is the arch of the aorta, and this is the superior vena cava, and here you can see the retrocaval group. Then the third group is known as the prevascular, and the prevascular are located along the course of the aortic arch. These are the prevascular lymph nodes, and this is the retrocaval lymph node. Then the aortic window lymph nodes are located between the ascending and the descending aorta above the pulmonary artery. Then you see multiple lymph nodes in the mediastinum representing aortic window lymph nodes, and this is the retrocaval group. Then the lymph nodes around the carina are known as the carinal lymph nodes. This is the bifurcation of the trachea, and you can see a group of lymph nodes here. This is known as the carinal or precarinal. And sometimes you can see also a group here which are known as the retrocarinal lymph nodes. Then the subcarinal lymph nodes are located between the bifurcation of the trachea, and this is the subcarinal lymph node. Then the hilar group of lymph nodes are located at the hilum, or the bronchopulmonary lymph nodes. And in this area you see a group which is known as the zygoesophageal group of lymph nodes, which are related to the esophagus and the azygos vein, and this is the group. Then the last group is known as the circumcardiac lymph nodes, and these circumcardiac lymph nodes are present around the heart, mainly along its anterior aspect, and many times they are associated with pericardial effusion, and this group of lymph nodes are highly pathognomonic of non-Hodgkin lymphoma. And whenever you see this group, you can say safely this is a non-Hodgkin lymphoma. Then most of the lymph nodes are not usually seen if they are normal, except one group, which is the retrocaval lymph node. And you usually ignore this lymph node if the patient is free, is doing a routine checkup, he is well known to have no primary malignancy, no lymphoma, no other pathology. And the only lymph node present in the chest is this one. Then you can ignore it as normal variant. This is the only group of lymph node which can be seen prominent in a normal CT scan of the chest. This is the usual size. You can see it's in the range of 1 to 2 centimeters. But most of the lymph nodes, other lymph nodes, are not usually seen. Then we came to the lung window, and we want to see the lobes of the lung and the segments. Then our anatomic landmark here is the trachea. Then whenever you are cutting in the chest, this is the left lung and this is the right lung. On the left side, you have the upper lobe, middle lobe, and lower lobe. On the right side, you have the upper lobe and the lower lobe. And we do an imaginary line here to separate the lingula from the upper lobe. Then whenever you see the trachea, you are cutting in the upper lobe. And this is the trachea, then you are cutting in the upper lobe. This is the left one, and this is the right one. Then here you can see the trachea, then this is the left upper lobe, and this is the right upper. In the right upper lobe, you know you have three segments: the anterior one, the apical, and the posterior one. On the left side, the posterior and the apical segment are combined. Then you have anterior and apicoposterior. Then in order to locate these segments on the CT, you should have two lines, like this. A continuous line and an interrupted line. On the right lung, you have three segments. This is the anterior, and this is the posterior, and in the middle you have the apical one. Anterior, posterior, and middle. On the left side, you have the anterior, the apical and the posterior are combined, forming the apicoposterior segment. Then, let us make a test. If you see multiple pulmonary nodules like this in the lung, and you look to the trachea and you can see the trachea, then you know you are in the upper lobe. And this is the left side, and the lesions are located anteriorly, then you are in the anterior segment of the left upper lobe. Okay. Then you see this is the trachea, and we see a mass in the lung. And on the left side, this is the anterior aspect of the left lung, then you are cutting in the anterior segment of the left lung. Then whenever you get to the hilum, and you see the trachea has bifurcated into two main stem bronchi. Then look at the section. You are here at the hilum. Then you see that the apicoposterior segment is no more present, but only part of the anterior segment is present. And now you see the superior segment of the lower lobe. On the right side, you see the anterior segment, and you also see the superior segment of the lower lobe. Then whenever the trachea divides into two, the section is divided into two. The anterior part belongs to the anterior segment of the upper lobe. The posterior part belongs to the superior segment of the lower lobe. Then here is the anterior segment of the left upper lobe, and this is the superior segment of the left lower lobe. And the same on the right side. Anterior segment of the right upper lobe, superior segment of the right lower lobe. Then, whenever I ask you about the location of this bronchogenic carcinoma, what do you say? Very good. Then, what do you think about this area?
Anterior segment of the right.
Anterior segment of the right upper lobe. And this area?
Superior segment left lower.
Very good. And this mass?
Anterior of the right upper.
Anterior of the upper. And this area?
Anterior of the right.
Anterior of the left. And this area?
Superior.
Superior of the right. Very good. Then, let us look at this metastasis. And here you can see the tracheal bifurcation. And what do you think of this cannonball deposit? Superior segment, left lower lobe. And this? Anterior segment, right upper lobe. And this? Superior segment,
The right lower.
right lower lobe. Very good. Then you came lower down where no trachea, no bronchi. And you are cutting in the cardiac shaft. Here. On the left side, you are cutting in the lingula and the lower lobe. On the right side, you are cutting in the middle lobe and the lower lobe. The lingula or the middle lobe comprises only 1/3 of the whole thoracic diameter. Then you draw a line dividing the section into anterior 1/3 and posterior 2/3. The anterior 1/3 on the left is the lingula. The anterior 1/3 on the right is the middle lobe. The posterior 2/3 on both sides belong to the lower lobes. Then, the lower lobe on the right side has 4 segments: anterior, posterior, medial, and lateral. Okay? On the left side, there are only 3 segments: anterior, lateral, and posterior. Okay? Then, in order to show these segments, you have 2 lines like this. Then, On the right side, this is the anterior segment, okay? And this is the posterior segment, okay? And here you can see the medial and lateral. This is the medial segment, which is very small, like depression in this area, and you cannot see a similar one on the left side. And the rest of this part represents the lateral segment of the lower lobe. On the left side, you have only anterior, lateral, and posterior. Good. Then, here you are cutting in the heart, no trachea, and no mainstem bronchi. Then you do a sectional line like this, anterior 1/3 and posterior 2/3. This area belongs to the lingula, and this area belongs to middle lobe, and this is the lower lobe on both sides. Then, the middle lobe has two segments, medial and lateral. The medial one is close to the heart, the lateral one is away from the heart. The lingula has two segments, the superior and the inferior. The inferior is close to the heart because it will reach the diaphragm, and the superior is close to the lateral chest wall. Then, can you see the fissure? And this is the fissure, dividing an anterior 1/3 and 2/3 posterior. Then, what do you think of this area?
Medial segment.
Medial segment of the middle lobe. Then,
Anterior of the right lobe.
anterior of the left lower lobe. Then,
Superior segment.
superior. The superior is close to the chest wall, the superior segment of the lingula. And here,
Middle of the medial.
medial segment of the lower. Medial segment of the lower lobe. Okay, and this is posterior segment of the right lower lobe. And this, anterior of the right lower lobe. And this, lateral of the right lower lobe. Okay. Then you have here multiple metastatic deposits. One here, and this one, and this one. Where are these metastases?
The lower lobe. Bilateral.
Okay, this one,
Posterior
posterior segment, left lower lobe. And this one, anterior, and this one, lateral. Okay, very good. Then, this patient had breast cancer and performed radical mastectomy followed by irradiation, and she got radiation fibrosis.
Anterior segment of the right.
Anterior segment of the right upper lobe, very good. Then, these are metastatic deposits from cancer colon. You can see one here and one there. What do you think? Anterior segment of the left lower lobe, lateral segment of the right lower lobe, medial segment of the right lower lobe. Good. Then this is a bronchogenic carcinoma. Apical segment of the right upper lobe. And you see this is the trachea, anterior segment, posterior segment, and the apical segment in the middle. Okay. Then this is a mnemonic consolidation. No.
Anterior segment of the left upper lobe.
Good. This is the anterior segment of the left upper lobe. The trachea is bifurcated into two. Then the section has been divided into two. Anterior segment of the upper lobe anteriorly, and the superior segment of the lower lobe posteriorly. Then, what do you think of this bronchogenic carcinoma with calcium inside?
Superior segment.
Yes, the superior segment of the left lower lobe. Okay, and this batch of mnemonic consolidation,
Superior segment of
superior segment of the lingula. Okay. Then this patient had tuberculosis